Welcome to America's Heroes Group.
And welcome to America's Heroes Group. You just heard our host, Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have our partner today, Jesse Brown, VA Works, America's Hero Group Roundtable. October is Breast Cancer, Mental Health, and National Disability and Domestic Violence Awareness Month. We have Jada in the studio today with her pink on, celebrating breast cancer awareness, doing everything she can with her red wristband and everything, or pink wristband and all that. Today is October 8th, 2022, Saturday, 4 o'clock as always. And we have a great show for you today. We're going to talk about some serious topics. On the topic of breast cancer, we have a panelist, Dr. Sarada Deshpande. She's a board member certified internist and has been on the Women's Health Medical Director at the JBVA, the Jesse Brown VA, since 2013. And we're going to talk about breast cancer awareness and where that has taken us today. That's something on everybody's mind because it's Breast Cancer Awareness Month. Doctor, are you with us?
Yes, this is Sarada Deshpande. Thank you for having me. Jesse Brown thanks WVON to be able to speak on breast cancer awareness in this month of October, which is a breast cancer month. Thank you.
Now, you have a particular focus in women's health, and you also want to now tell us about the importance of screening. How important is this? We're going to go into a lot of details about this topic, particularly after the fact that the pandemic kind of made a lot of women stay home and not get their checkups. Something like 30% of women did not get their checkups during 2020 during the pandemic. Let's talk about screening. What is important about that?
Absolutely. This is a great question. Breast cancer is the second leading cause of cancer death in women following the lung cancer. Besides skin cancer, breast cancer is the most commonly diagnosed cancer amongst American women. And if you look at statistics, 1/8 of the U.S. women will develop invasive breast cancer over the course of their lifetime. This is a serious concern, but has a 99% survival rate if it is detected very early. That's the reason screening is extremely important.
So tell us about the different stages of breast cancer. From doing some research, I didn't realize it was a stage 0. I've heard of stage 1 through stage 4, but breast cancer has a stage 0 and it goes to stage 4. And particularly in that, tell us about DCIS, which is, from what I understand, ductal carcinoma in situ. Is that right? And also
right.
Triple negative breast cancer, because those are two extremes. Tell us about those two things and kind of give us an idea about those different stages of breast cancer.
Okay. So the first question, DCIS, it's a cancer which is in situ, ductal carcinoma in situ. This is a cancer that is still within the cell membrane of the cell. So the goal of the good thing is if we take care of this, DCIS will prevent the occurrence of invasive breast cancer. That is the DCIS. And then you wanted to know the staging, right?
From stage 0 to stage 4. So because we're talking about screening, so getting to it early is critical. So when you're in stage 0, that's something like is that DCIS? Is that correct?
Right. Stage 0 is DCIS. Let me get 1 second.
And then we move on to stage 4, which gets really critical at that point. And then we worry about things spreading once you get to stage 4. So understanding the different stages might be helpful because I think a lot of people have kind of gotten complacent because we hear about breast cancer all the time. And then with the pandemic, people staying home, a lot of people haven't really been getting the screening. People are doing self-checks at home, but they're not getting the screenings, is what I understand.
Yes. Stage 1, breast cancer is what we call local disease. And, this is a very early stage breast cancer, and the treatments are very the treatments that are offered at this stage are conservative therapies, So staging is extremely important, and getting the diagnosis very early on is very important too. And like you mentioned earlier, a lot of patients during the pandemic have not gotten their screening mammograms, or for that matter, other screening tests for other things too. Then what else I should say about the staging?
So then, when we get into stage 3 and stage 4 breast cancer, how fast can someone progress? Because I've heard stories. Katie Couric, for example, on one of the anchors on, been around forever on NBC. She talked about her experience with breast cancer, and then like she said that she just forgot to do it for like 6 months, and she's been getting them regularly because her husband died from colon cancer. So she went and got tested after 6 months, and she had cancer. She had breast cancer, and it wasn't in the later stages, but it was still had progressed enough where it was very, very serious.
Right, but most patients who present with breast cancer usually have disease that's confined to what we call to the breast with no or much metastasis. Usually, these are the patients that are called stage 1 and 2. That the disease is confined to the breast. And then the 3 and 4 are the metastatic breast cancer. Like you mentioned, the metastatic breast cancer is a poor prognosis. And if this cancer is detected very early on, 99%, there's a survival rate of 99%.
Wow.
And then the COVID-19, I agree with you, especially, because of the delays in the treatment, screening, and everything, with the social distancing and a lot of, the way we delivered care has changed during the pandemic. So, yeah, there were some issues which were real during this pandemic.
So how young should a woman be, or how young can a woman be before they start thinking about getting screenings?
Right. That's a great question. Number one, we usually follow American Cancer Society guidelines. So according to American Cancer Society guidelines, average risk women should get screening mammograms every year starting at the age 45. And 45 to 54, they all should get up to every year. And women over 55 should be screened every other year. That is biennially. And women should have opportunity to continue to screening annually, even with this age group, with 45 to 54. There is no end limit for screening mammograms anymore as long as women are healthy and their overall health is good and they have a life expectancy of 10 years or longer. So we start at 45. And in fact, we can start the discussion at 40 itself.
Wow. Now, one thing I noticed on the Mayo Clinic, on their front page of their website, when they talk about breast cancer, they talk about the importance of self-screening, but they mention that self-screening in their eyes wasn't necessarily as effective as other types of getting actual screening, a physical screening in an actual facility. What is your take on getting screening or doing self-breast exams? And if you're doing self-breast exams, what's the proper way to do it?
There is most experts agree now breast exams are not indicated anymore because this has, there were several studies looking at this, and this has led to unnecessary biopsies and things like that. So for screening, we do not recommend any more self-breast exams. But breast cancer screening, the best method we have right now is a screening mammogram. And this is used to look for any early signs of breast cancer, even when patients don't have any other symptoms. And this mammogram is actually an X-ray picture of the breast. During this examination, the breast is placed between two plates. There are two views taken, one from the top, one from the side. And sometimes, depending on what the screening initial mammogram shows, the radiology doctor might recommend for the testing called a diagnostic mammogram, where there are, if there is any findings on the initial screening mammogram, which involves more views than two. Then sometimes we also use ultrasounds to diagnose as well as to perform breast biopsies if the diagnostic mammogram shows anything. And women who are at increased risk of at least 20% over their lifetime of breast cancer, they receive the special testing called breast MRI. Breast MRI catches cancers that are harder to detect by mammograms.
Now, was the 3D mammogram, is that the gold standard today for getting mammograms? Because there's, what I've read, there's 3D mammograms and there's standard mammograms. What does the JBVA use, and then what is the most effective way?
Yeah, Jesse Brown VA Hospital currently do not have in-house mammography. And we refer our patients into the community through a process called community care referral process, where a doctor places an order and there is a department called community care who reaches out to the patient trying to get these patients appointments in the community. But we also have a mammography care coordinator in the VA at the Jesse Brown, who actually works with the patient, the community care, and the outside, the mammography vendor.
So one thing I noticed too also is that, according to the VA statistics, and also according to what the research says, the women veterans are 20 to 40% more likely to get breast cancer. So this leads me to this question. So is breast cancer more so, when I try to find information on the causes of breast cancer, it led me to think that maybe there was more family history or possibly genetic, but then
Right.
a lot of people get breast cancer with no history of no family history whatsoever. There's not even finding a lump when they do a self-exam. So what do veterans need to do, women veterans in particular, in order to take advantage of what the VA offers at Jesse Brown?
That's absolutely right. According to the American Cancer Society, some of the risk factors are family history, first degree, second degree relatives having cancer. But like you mentioned, most of the women who come with breast cancer do not give family history of breast cancer. And at the same time, even if someone has all the risk factors or one or more risk factors, it doesn't necessarily mean that they will develop breast cancer. Then it also depends on the genetic makeup. The breast density is one of the risk factors, and hormonal factors. And there are several other risk factors like alcohol consumption and being overweight after menopause, as well as not being physically active. What is Jesse Brown doing? The first thing any woman veteran can do is getting an appointment with the primary care doctor. That's where it starts. And Jesse Brown VA Hospital as women physicians who are designated as women's health providers. We have a women's health clinic. We have a women veteran program manager. We also have a mammography care coordinator at the Jesse Brown VA Hospital. Yeah.
So one of the things I wanted to ask, we had planned to have one of the licensed clinical social workers here with us today, but she wasn't able to make it. But the question I wanted to ask her, maybe you can answer this question, is how important is it to advocate for women's health? Women's health program that you have at Jesse Brown VA is critical, but how important is it and why is it necessary to advocate for women's health?
Absolutely. It is extremely important because women veterans have unique medical issues, mental health issues, psychosocial issues, and at Jesse Brown, we have designated women's health providers who do take quite a bit of training courses online. What is called mini residencies and things like that to specialize, and we actually have a comprehensive women's health care center in our at Jesse Brown VA. We have social workers that work with us. We have psychologists that work with the primary care providers, along with gynecologists. We are lucky to have two gynecologists with us, and one of them is actually a very specialized gynecologist called urogynecologist. We have a lot of resources at Jesse Brown Women's Health Care Clinic, and another important thing is we are very excited that recently we were told that we've been approved to initiate mammography breast imaging services on site, and also to get this comprehensive mammography program so that we can get the veterans the screening mammograms and depending on what the screening mammogram, what they need, to offer all these on site at Jesse Brown.
So one thing that we talked about earlier in this show, we mentioned that 45 is the right age to start getting mammograms for women. However, because of the fact that a lot of women veterans are getting breast cancer at such alarming rates, And most women who are in service, I mean, they're joining typically when they're in their 20s. And we've seen cases of women with breast cancer. I've seen a case with 27 where someone passed away doing research who had no symptoms and they have been doing regular exams, seem relatively healthy, but unfortunately did not get screened, and then it metastasized. And when she went to go get it checked out, next thing it was hard to treat or hard to get on to conquer. Is it a good idea for women veterans in particular to maybe think about getting screened earlier versus waiting to 45?
Yeah, absolutely. So the first thing is having a discussion with the primary care provider so that they can come up with the risk assessment, that they look at several things in that questions. There's a questionnaire for that. And based on that, once they decide what is the risk, then we can, move from there. Because even for average risk women, we should start discussing, the women patients should have given the opportunity to start discussing at the age of 40. And definitely women with higher risk, like with family history and genetic mutations and things like that, they should be starting screening early on, and not just with mammograms, in that case with MRI of the breast.
So I got two questions that offer the last question we just talked about. So getting screened early, we know that's critical. So how is Jesse Brown how is Jesse Brown's view on preventative maintenance or preventative screening on just in general? Because it seems like the more we do things early with our health, when we start just finding out what the problems are, getting the screenings, whether it's breast cancer, whether it's colon cancer, whether it's other different things, we do better in life in general because we can detect it and get treated earlier. So is that something that's a focus of Jesse Brown, the preventative side? Because we typically think in the regular world, we don't do anything till we get sick. We wait till we get sick, then we go to the hospital, we go to the emergency room, but we don't put a lot of time and effort and attention into trying to maintain and prevent certain things from happening to begin with.
Absolutely. It's not, I agree totally 100% with you, not just breast cancer, all the general health screenings that patients need, depending on their age and sex and things like that. The best thing is we at Jesse Brown, we have a comprehensive primary care health that patients are seen, and we do have, depending on their age, again, age-appropriate screenings and things like that. So Jesse Brown, in fact, actually has a group that works, that looks at all these screening metrics and things like that. So it's very important. The first step is for any women veteran is to get an appointment with the primary care. And we do know that patients, when they get primary care appointments, they do better care because the primary care doctor does a comprehensive evaluation and try to get these patients whatever they need, whatever it may be, the breast cancer or diabetes, or for that matter, whatever that is. Yeah. So the first step is coming to the primary care clinic and seeing the primary care doctor.
Now, this is the question I didn't really want to ask you, but I'm going to ask it because I think it is important. And the reason why I didn't want to ask this question is because it lets people, in my mind, and I'm judging in some way, it makes people more complacent because they wait, once again, like based on my last question, they wait till the last minute to get checked, and then sometimes it's hard to treat something when you let something get worse. But what are the signs and symptoms of breast cancer? If a woman is having to the point where they start seeing signs and symptoms, what are the things to look out for, and what should they do at that point?
Right. See, our goal is to find them even before they have symptoms. That is what we were talking about earlier with screening. But what are some of the symptoms and signs of breast cancer? One is new lump in the breast or in the armpit, dimpling of the skin, discharge from the nipple, or pulling of the nipple, or redness in the breast area. Or if there is any swelling that they see, or pain in the breast, or change in the size or the shape of the breast, these are some of those. Any of these symptoms, they should talk to their primary care provider right away, to their healthcare provider.
Then once again, how often should the mammogram be done or screening be done?
And the screening, according to American Cancer Society guidelines, the screening, every woman should have regular screenings every year at the age of 45. From 45 to 54, they should be screened annually, and women 55 and up should be screened biannually. And women should continue screening mammograms as long as their overall health is good and they have a life expectancy of 10 years or longer. So there's no cutoff for this, but please continue.
And this is my last question. We have about a minute left. So if you ever had to diagnose or actually tell someone the bad news that they had breast cancer?
Hello?
Yes, can you hear me?
I couldn't hear you 1 second before. Can you please repeat the question?
We got about 50 seconds left. But have you ever had to diagnose someone with breast cancer or tell someone the bad news that they had breast cancer?
Oh yeah, yes, yeah. Breast cancer. We have a mammography care coordinator in the clinic. We actually monitor all breast cancer diagnosis patients, making sure that they get the necessary treatments. Yes, of course. I've seen many women with breast cancer diagnosis, and I have given the diagnosis myself to the veteran in my clinic. Yes.
And the reason why I wanted to ask that question, but we ran out of time, is that I wanted to know what a woman felt. What's the reaction that someone gets typically when they are told that they have breast cancer? You know, when I did a colonoscopy, and the doctor told me, he said, you know what, most men would give me a sigh of relief. He said most men die with colon cancer. They don't die of colon cancer. So we got to treat this. We got to get this taken care of. But that was clean. So, doctor, thanks for your time. I appreciate you coming on our show. Sarada Deshpande, doctor, board certified internist, and has been in the Women's Health Medical Director of JBVA Brown VA since 2013. I appreciate your time.
Thank you so much.
This is America's Heroes Group.